We're thinking about special tests. So we already said that's one of the things that can worsen, could be maintaining the arm in sustained positions. So one thing to consider are the utility of some tests that we can find. One of them is the hand elevation test. So you put your hand above your head for about a minute. Now, if you are there and you get symptoms before that and they start getting worse, you don't need to keep it for about a minute. But that's one thing you can do. You can actually put both arms if you want to at the same time, and you can see quick comparison. So that seems to be actually a very good clinical utility towards the diagnosis of carpal tunnel syndrome. 3 other tests that are not as good apparently as the hand elevation test, but have good accuracy, is the Dawkins test, which is a compressive test, direct compression over the carpal tunnel for about 30 seconds. The Phelan test, which is hyperflexion for a minute. You're creating that compression indirectly rather than squeezing. So sometimes it's better to use that, in my opinion, before doing directly with the Dawkins. Tunnel test is a percussion. So you're percussing over the carpal tunnel. You can even go along the line of the median nerve and see whether that can, because you're trying to differentiate whether it's carpal tunnel, maybe it is at the pronator. So again, you could be getting symptoms which are occurring not as a carpal tunnel, but more proximal. For me, it is important to consider the nerve mobility, and obviously talking about in these neurodynamic tests, particularly your median nerve.